I'm Todd Cruz from Optivus Physical Therapy, and today we're going to talk about some basic lifts for those of you who are beginner weightlifters and for some of those of you who are lifting regularly and would like to have some thoughts about differences going on. With me is Logan Anderson. She's a student physical therapist from Briarcliff University, and she'll be our subject today. The first lift we're going to do is a squat, and I'm going to have Logan have you step underneath the bar. Some of the practical things we look for in the squat is, do the knees come together? Go ahead and go down a little bit for me. So let me start over again. The first positioning is, we're looking for about shoulder width to hip width apart. Logan shows shoulder width apart with her feet. She's going to gradually go down. We're going to make this slow and hard on her. And what I'm looking for is that the butt hinges back as you come down, and then you're going to sink down slowly. The next thing we're looking for from a front view is that the knees do not come together. She's demonstrating them coming together right now. That's what we'd watch out for. Now, a little bit on those of you who lift heavier, I'm not going to worry about, but that should be something you can control. We're going to look at the side view for Logan here now. What I'm looking for as she goes down is that the bar path stays vertical, so it stays directly over the feet where she's at, within a range of a few inches. So slowly go down. She hinged back with the hips first, and the bar stayed vertical up and down right where it is. The other thing to watch, and I don't know if we can get this on a camera view, is we want the spine to stay in neutral. It's just set right where it is. Some of you with low back pain, often you're arching a lot in your low back, creating a huge lordosis, and sometimes that bothers the facets. Others round forward a little bit. We want the large muscle groups to do the work. So as you come down, it's the movement at the hip and at the knees. Go ahead again, Logan. So right here is where I'd like to see the movement coming back, and she has a line of her trunk and a line of the tibia coming down and then coming up. And nothing is moving through this area. It stays still so that the large muscle groups can take care of that. The lift we're going to look at is a lunge, and Logan is going to show us a couple of deviations we'd like to try to avoid. So go ahead, Logan. What happened here is she let that knee rotate in quite a ways. That shows a lack of hip control as the rotation goes all the way through the lower limb. We would look to have that knee go directly over the foot, in line with the foot. And that's a much better lunge on that stance leg with the left leg. The other deviation is people will compensate at their pelvis. They'll rotate at the trunk and everything instead of staying in line. So we'd like to just make sure on the lunge that it's just down and up right where you're at. Love the lunge for single leg strengthening, so if you have a weaker leg, it's all on that leg and it can't be compensated for with the other leg helping it out with some of the other lifts. And it really gets the hips to control everything. Thank you, Logan. That is a deadlift. Picking something up off the floor, very functional task. It's a very big buzzword right now. We're going to have Logan come down. What I like to tell people on this is lock in. Her back is nice and locked and straight. Then I'm going to have you slowly lift. And again, we want the large muscle groups. Go ahead and go up, Logan. We want the hip coming forward as she does this. I don't want at the top the back to arch extreme. That's all low back. I want the hips coming forward and the glutes squeezing to get that up. Go ahead and come down again. We're going to tire her out and get a couple of these going. So she's locked in. The other thing to look for is that people stand up at the hip first. And I'll have you do that as a demonstration. They stand up at the hip first, and that puts a lot on the hamstring, and then it's a little more torque and the bar gets away from you. The other thing people do with a conventional deadlift that we'd like to avoid is really round the back. And if you're careful, Logan, we're trying to stay locked, and she's not locked there. I would rather the large muscle groups pick this up than have the back rounded out and having it. So again, the deviations we don't want is we don't want it rounded out, we don't want the early hip rise, and we want to make sure that it's the large muscle groups coming in and lifting up. So the hips move forward. At the top, it's a squeeze from the buttocks, not from the back arching back.